and which causes weakness of the elastic support and muscle tissue, which descends to the anus, causing hemorrhoids. So hemorrhoidal disease grades, all we know, grade 1, grade 2, grade 3, grade 4 and grade 4 files. Grade 1 only bleeding, grade 2 prolapse comes out and goes automatically, grade 3 needs manual irrigation, and grade 4 remains permanently outside. Next. So what is laser? Before going to learn the laser proctology workshop, we should first learn the physics of the laser. Laser is light amplification stimulated emission of radiation. Next. In 1917, Albert Einstein laid the foundation of laser technology when he predicted the phenomena of stimulated emission, which is a fundamental to the operation of all lasers. In 1959, Dr. Jordan possesses the stimulated emission, which can be used to amplify light, and he describes an optimal resonator that can create a narrow beam if coherent light and be called as laser. In 1963, CO2 laser was first developed by Kumar Patel at ATT and Labs, and CO2 laser has much lower cost and higher efficacy than the ruby laser at that time. So there are two wavelengths in proctology. One is 1470 and one is 980. The question is, why should I use 1470? Why not 980? 980 is cheaper laser, 1470 is costlier laser. Shall I use 1470 or 980? The question is in everyone's mind. The basic difference is that for 980 nanometer laser wavelength, absorption coefficient is higher for the hemoglobin than water. And when unlikely 980 nanometer radiation, endogenous laser treatment which needs appropriate power of 10 to 12 watt for the treatment, and by 1470 when you are doing the laser treatment or endogenous laser treatment, it needs hardly 5 to 8 watt radiation, and this is a low energy level, significantly minimizes the adverse effect. So the difference is that the laser wavelength for 980 nanometer, the depth of penetration in water is 2 centimeter and depth of penetration in hemoglobin is 0.5 centimeter, while that of 1470 nanometer is 0.003 centimeter. Next. So why we choose 1417 laser? Because the vein structure is mostly water, and 1417 nanometer laser is a water specific laser targeting water as a chromophore. This is the most important factor, and which absorbs the laser energy. An optimal depth of penetration in water is 0.03 centimeter and resulting in an optimum male ablation, and the laser energy is preferentially absorbed in the intracellular water wall content of the vessels and the water content of the blood. So the irreversible photothermal process induced by the laser energy results in a complete occlusion of the treated vein, and once the treated vein is occluded, it will never reopen. So no risk of damage to the surrounding tissue with the 1470, as less watt is required, less energy is required, and less depth of penetration adds a safety of the elements and safety of the patient of the disease. So principle of the laser energy, there are three main principles in laser treatment while treating with the hemorrhoid patient. One is photoablation, another is photocoagulation, and third one is photovaporization. First, photoablation, there is a tissue distraction. When we introduce the fiber in hemorrhoidal complex at the base of the hemorrhoid, what happens? There is a tissue destruction which causes water-borne destruction, and hydrogen ion is emitted. You will hear the sound that we can call is as samyak dakta sound while treating the hemorrhoids. Tut sound. That is the breakage of the hydrogen ions, and it causes the shrinkage of the tissue. Next is photocoagulation, which causes protein denaturation at 76.6 degrees Celsius to 132 degrees Celsius, which causes sealing the blood vessels and which causes dearterization. And photovaporization is that where the tissue absorbs the laser energy at 80 to 90 degrees centigrade, and there is a shrinkage of the hemorrhoidal pile mass, which forms a coagulum and fibrosis after 6 weeks to 8 weeks duration. So this is the complete mechanism of the laser in hemorrhoid. So this is again in short mechanism of laser hemorrhoidoplasty. What happens when we do a laser in hemorrhoid? There is a fibrous reaction in the endothelial tissue and connective tissue which causes the narrowing and closure of the blood vessels and which causes deflection and drying effect, and ultimately it gives a retraction and fixation of the hemorrhoid pile mass to the normal position. This is the basic principle. So laser of hemorrhoidoplasty is, the probe is introduced. You can do it in local anesthesia, saddle block or short G. The probe is introduced through an anal prolapse under the surface of the anodome and inserted by the submucosal space till 2 cm above the hemorrhoidal cushion. A laser is set to power of 7 to 8 watts. In some machines it is set at 6 watts. The different setting is for different machines.
अचानक का होतं अचानकच होतं ते मध्येच काय नाही आपण ते करूया रेक्टिफाय.
Hello.
Better.
Science has advantage and disadvantage also. So the laser is set for power of 7 to 8 watt and a single pulse of 3 seconds duration. The energy was delivered in a single shot of 3 seconds. And during each shot, the probe was held in a position while being gently rotated and around its axis to ensure the uniform application of light and prevention of adherence to the tissue. So while using laser, you should always wear a goggle. Assistants, patient and doctor, there should be 3 goggles in OT. Company provides only 1 or 2 goggles, but there should be 3 goggles in OT. And OT should be instructed at that a sign is stick on OT door that the laser procedure is going on, so that no one staff will come directly. Because I have seen practically one case happen during laser surgery when the surgeon was operating a patient for hemorrhoid and accidentally he pressed the foot pad and the laser energy and laser fiber went into the femoral artery and femoral artery damages. Luckily, surgeon was happy by taking treatment emergency in ICU, and so another case was there while treating the patient was in saddle block and he moves his hand and someone has pressed the foot pad and the energy directly emitted and the patient's retina was damaged. So 3 goggles are always important. 1 for patient, 1 for surgeon or assisting surgeon or staff. Next, this is the laser hemorrhoidoplasty animation. Please run the video. You can see the hemorrhoidal pile mass. It is going. This is the hemorrhoidal pile mass. So always use slit proctoscope. Do not use steel metal glass proctoscope while doing laser, because the lasers can emit and can transfer from the metal proctoscope. Always use glass tip or fiber proctoscope. So this is the fiber. There are 2 fibers which is used in laser surgery. One is conical fiber and another is radial fiber. A conical fiber is having a glass tip at the tip, and bare fiber you can use by removing the outer shell of the fiber. And for hemorrhoid, these 2 fibers are used. Mostly bare fiber is good for Indian conditions, that you can use it for longer duration and there is less chances of breakage of the tip. And for fistula, pilotoidal sinus, varicose veins and cosmetic laser gynecology, we use a radial fiber which emits energy in 360-degree angle, while the bare fiber emits energy from the tip directly. Next, we'll see video directly. So this is the bare fiber which we are using. First, we are doing laser mucopexy by ablating above the dentate line. For grade up to grade 2 and grade 3 early file mass, we never take a suture mucopexy. Only there is prolapse, we use suture. Then insertion of the fiber at the mucocutaneous junction up to the base of the hemorrhoids and rotating towards the direction of the hemorrhoid will give 100 to 150 joule energies. Do not give more energy. More energy will cause thermal damage and it will cause injury, thermal injury also. So for early grade 1 to grade 2 files, 100 joule energy is sufficient. At the base, you can use 50 to 60 joule of energy just for spraying. And for grade 3 files, you can use 150 to 200 joule energy max. And for grade 4 joules, grade 4 files, you can use 250 joules max. So next, and always keep ice pack after the procedure. This is a 3 o'clock file mask. You can hear the sound, which is the breakage of the hydrogen ions.
Doctor, can you increase the volume from there if you can? Maximum. Stick.
So do not rotate towards the internal sphincter. It can damage the internal sphincter. Always rotate towards the hemorrhoidal plexus and gently rotate. Do not do vigorously. While inserting the probe, you should give some energy, and while removing the probe, you should give some energy so that there will be no bleeding from the insertion point. Next, this is grade 3 file. Sound mute, please.
Mute.
So this is again 7 o'clock file mass. We are giving the energy at the base. Then we are inserting from the mucocutaneous junction up to the base. And we are giving 100 joule energy in the hemorrhoidal complex. Always give energy above dentate line. If you give energy below dentate line, it will cause pain, severe pain to the patient. And the patient will complain that I underwent laser surgery and I am having still pain. So someone will blame for laser. The technique is faulty, not laser. Nowadays there are a number of companies selling their lasers. So choice depends on you. Only I will suggest if you are doing proctology, select 1417 laser. Because post-operative pain is very minimum with 1470. Less energy, so less pain, less tissue damage. Same at a time you can do all 3 hemorrhoid file mass. At 3 o'clock again we had done same procedure. Next video I will show in next video. So sound is there. Again, start the laser at 3 o'clock first or 7 o'clock first and 11 o'clock last. Because when you do 11 o'clock first, sometimes it will cause bleeding and it is very anodyne for the surgeon while seeing bleeding and operating the hemorrhoids at another sites. So anteriorly, while entering the fiber inside the hemorrhoidal complex, sometimes it is difficult. So there are few points while entering the fiber. It should be a very gently. A resistance should not be there. If there is resistance, you are in wrong plane. The light which is seen while the fiber is inserted inside the hemorrhoidal complex should not be too light, too dark or too light. If it is too dark, means you are in wrong plane. If it is too sharpened, you are very near to mucosa and there is a chances of damage to the mucosa. There is a chances of burning post-operatively because of the thermal damage. And always use ice pack. So making of ice pack is very simple. Take a normal saline, sterile normal saline in gloves and pack it and use that finger for the as a ice pack. Do not apply direct ice as sometimes it can cause frostbite. Run this. And after energy, you have to press for few minutes to prevent hematoma at that site. If there is prolapse piles, you can avoid this procedure. Here you can take a suture mucopexy and then give energy 100 joule to 150 joule in hemorrhoidal complex while rotating towards the axis of the hemorrhoid. So why we insert at the mucocutaneous point the laser energy? Because it is the point where the anastomosis of the superior hemorrhoidal artery and inferior hemorrhoidal artery takes place. So why inserting at the dentate line and why inserting at the mucocutaneous point? At dentate line, if you insert, there is less pain, but the collateral branches are not covered, so there is a chances of recurrence, and again laser is blamed. While entering at this point, you will cover the all collateral branches, secondary branches. So all the collaterals are covered, all the vessels are ablated, and there may be less chances of recurrences. Next. So these are the pre-operative and post-operative results on table. This is grade 4, and this is grade 3 hemorrhoid. In grade 4, we have taken laser along with the suture mucopexy, and here we have directly done laser. Next. So benefits of laser hemorrhoidoplasty: faster recovery and ability to return to normal activities, and perioperative pain seems to be significantly decreased. Post-operative pain is also very less. Although the spontaneously hematomas and edemas has been reported, their incidence remains very low. The perioperative bleeding is very minimum. No urinary retention, as the post-operative pain is very less, and post-operative anesthesia needed very less. So significant decrease on post-operative pain intensity and duration, and they minimize the possibility of anal sphincter damage with subsequent incontinence development. Next. Thank you very much.